Welcome. In this video, we'll be discussing a rare but significant urinary system disease, a squamous cell carcinoma of the urethra. We'll delve into its causes, how it develops, who it affects, how it presents, and the available treatment options. This information is for educational purposes and should not be considered medical advice. Please consult with your healthcare provider for any health concerns. Squamous cell carcinoma of the urethra, or USCC, arises when squamous cells, which normally line the urethra, undergo malignant transformation and begin to grow uncontrollably. The exact cause isn't always clear, but several factors have been linked to its development. Chronic irritation, such as that caused by recurrent urinary tract infections, urethral strictures, or long-term catheter use, can increase the risk. Human papillomavirus, or HPV, particularly high-risk strains like HPV, is a major culprit, especially in women. Smoking is also a risk factor, as carcinogens in tobacco smoke can be excreted in the urine and come into contact with the urethral lining. In some cases, prior radiation therapy to the pelvic area can increase the risk of developing USCC later in life. The pathophysiology of urethral squamous cell carcinoma involves a complex series of cellular and molecular events. Initially, chronic inflammation or viral infection can lead to dysplasia, where the urethral cells become abnormal but not yet cancerous. Over time, if these abnormal cells acquire additional genetic mutations, they can progress to carcinoma in situ, which is cancer confined to the surface layer of the urethra. If left untreated, these cancerous cells can invade deeper into the urethral wall and eventually spread to nearby tissues, lymph nodes, and distant organs. The specific genetic alterations involved can vary, but they often affect genes that control cell growth, DNA repair, and programmed cell death. The tumor microenvironment, which includes immune cells and blood vessels, also plays a crucial role in tumor growth and metastasis. Squamous cell carcinoma of the urethra is a rare malignancy. It accounts for less than 1% of all cancers in both men and women. The incidence tends to increase with age, with most cases diagnosed in individuals over 60. Women are more frequently affected than men, largely due to the higher prevalence of HPV infection in women. Certain geographic regions and population with lower socioeconomic status and limited access to healthcare tend to have higher rates. Precise statistics vary depending on the region and data collection methods. The signs and symptoms of urethral squamous cell carcinoma can be varied and sometimes nonspecific, leading to delayed diagnosis. Common symptoms include hematuria, or blood in the urine, dysuria or painful urination, urinary frequency or urgency, a palpable mass in the urethra or groin area, and urethral discharge. In men, symptoms may also include weak urine stream or difficulty emptying the bladder. In women, the tumor may present as a vaginal mass or bleeding. Advanced disease can cause pelvic pain, lower extremity swelling, or weight loss. It's important to note that these symptoms can also be caused by other, less serious conditions, but any persistent urinary symptoms should be evaluated by a healthcare professional. Diagnosing urethral squamous cell carcinoma typically involves a combination of physical examination, imaging studies, and tissue biopsy. A physical exam may reveal a palpable mass or tenderness in the urethra or groin. Urinalysis can detect blood or abnormal cells in the urine. Cystourethroskopy, a procedure where a thin, flexible tube with a camera is inserted into the urethra, allows direct visualization of the urethral lining in any abnormal areas. Imaging studies, such as CT scans, MRI scans, and PT scans, are used to assess the extent of the tumor and check for spread to nearby lymph nodes or distant organs. However, the definitive diagnosis is based on a biopsy, where a small sample of tissue is taken from the suspicious area and examined under a microscope by a pathologist. Urethral squamous cell carcinoma is typically classified based on the TM staging system, which stands for tumor node and metastasis. This system assesses the size and extent of the primary tumor, whether the cancer has spread to nearby lymph nodes, and whether it has metastasized to distant organs. The stage of the cancer is a major factor in determining the appropriate treatment and prognosis. There is no subtype classification system for squamous cell carcinoma of urethra. Treatment for urethral squamous cell carcinoma depends on the stage of the cancer, its location, and the patient's overall health. Treatment options may include surgery, radiation therapy, chemotherapy, or a combination of these. Surgery can involve local excision of the tumor, partial or complete urethrectomy, a removal of the urethra, or cystectomies, a removal of the bladder in more advanced cases. Radiation therapy uses high-energy rays to kill cancer cells and can be delivered externally or internally, a brachytherapy. Chemotherapy uses drugs to kill cancer cells throughout the body and is often used in combination with surgery or radiation therapy for advanced disease. In some cases, targeted therapies or immunotherapies may be considered. particularly for tumors that have specific genetic mutations or express certain immune markers. Treatment decisions are typically made by a multidisciplinary team of specialists, including urologists, oncologists, and radiation oncologists. Follow-up care is essential to monitor for recurrence and manage any side effects of treatment. While it's impossible to completely eliminate the risk of urethral squamous cell carcinoma, there are several steps you can take to reduce your risk. Vaccination against HPV can significantly lower your risk of HPV-related cancers, including urethral cancer. Practicing safe sex, including using condoms, can also reduce your risk of HPV infection. Avoiding smoking is crucial, as smoking is a known risk factor. Promptly treating urinary tract infections and other conditions that cause chronic urethral irritation can also help. Finally, regular checkups with your healthcare provider can help detect any problems early, when they are more easily treated. The prognosis for urethral squamous cell carcinoma varies depending on the stage of the cancer at diagnosis, the patient's overall health, and the response to treatment. Early-stage cancers that are confined to the urethra have a better prognosis than advanced cancers that have spread to lymph nodes or distant organs. Recent research has focused on identifying new biomarkers that can predict prognosis and response to therapy. Immunotherapy and targeted therapies are also showing promise in the treatment of advanced urethral cancer. Ongoing clinical trials are exploring new ways to improve outcomes for patients with this rare and challenging disease. Thanks for watching.